PQRST, Nursing Pain Assessment. Fundamentals of Nursing. PQRST is a widely used tool to assess and document a patient's pain comprehensively. It helps clinicians understand the nature, location, and impact of pain to guide treatment. Here's a concise guide you can use in Fundamentals of Nursing. What PQRST stands for. P. Provocation or palliation. What triggers or worsens the pain. What brings on the pain. What makes it feel better or worse. For example, position, movement, medications, rest. Q. Quality or quantity. How would you describe the pain? For example, sharp, dull, stabbing, burning, throbbing. Is it constant or intermittent? Rate the intensity. If using a numeric scale. R. Region or radiation. Where is the pain located? Does it stay in one place or radiate to other areas? For example, arm, jaw, back. S. Severity or severity scale. How severe is the pain on a scale? Commonly 0-10, with 0 means no pain and 10 means worst possible pain. How does the pain affect daily activities? T. Timing. When did the pain start? Is it intermittent, daily, or constant? What is the pattern over 24 hours? For example, morning pain, nocturnal pain. Quick clinical guide. Use open-ended questions first, then follow with targeted questions. Always assess both subjective, patient, and self-reported, and objective, behavioral, and physiological cues. Consider using additional scales for special populations. FLACC, that is, face, legs, activity, cry, consolability. For nonverbal children or adults with communication difficulties. Wong-Baker Faces Pain Rating Scale for children. CategoryRIMA and NIPS, etc. As appropriate for specific conditions or populations. Reassess after interventions. For example, 30-60 minutes after analgesia, and document changes. Sample documentation. Example, component, patient report, observation, provocation or palliation. Pain worsens with movement, relieved by rest, and OTC, acetaminophen. Quality or quantity. Describes as sharp and stabbing in the left thorax region. Settings, 6/10 at rest, 8/10 with exertion. Region or radiation. Localized to left chest with occasional radiating sensation to left arm. Severity or timing. Onset 2 days ago. Constant with episodic spikes. Worst in evening. Timing. Continuous with intermittent flare-ups. Improves slightly at night after sleep. Interventions and patient response. Administered PRN analgesic. Pain decreased to 3/10 after 45 minutes. Practical tips for students. Start with, can you tell me about your pain? And then guide with PQRST questions. Document exact patient quotes. When possible, use standardized pain scales appropriate to the patient's age, development, and cognitive status. Include functional impact, sleep, appetite, mood, participation in activities, work, or school. Consider contributing factors. Past pain experiences, analgesic history, allergy to medications. Pain assessment is part of comprehensive nursing assessment and should be followed by a plan of care, including non-pharmacologic and pharmacologic interventions. Evidence-based practice emphasizes regular pain reassessment and timely documentation after interventions.